Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. In previous updates, I've explained the role that vitamin C plays in supporting immune system function and helping to guard against the life-threatening cytokine storm associated with severe respiratory tract infections. Now, this brings us to this very interesting publication from the Chinese Journal of Infectious Diseases, published in 2020. As the abstract states, as the experience in the Shanghai prevention and control of COVID-19 accumulated and the understanding of the disease gradually deepened after absorbing domestic and foreign experience, Shanghai Clinical Treatment Expert Group for COVID-19 detailed and optimized the treatment approach and issued an expert consensus statement on the etiology and epidemiology, clinical characteristics, diagnosis, and the treatment of COVID-19. So what's fascinating to read in their paper entitled Comprehensive Treatment and Management of Coronavirus Disease 2019 Expert Consensus Statement from Shanghai is the inclusion of intravenous vitamin C therapy as part of the recommended treatment protocol for patients with mild COVID-19 symptoms and for patients with moderate and severe COVID-19 symptoms. The recommendation for the use of intravenous vitamin C is largely based on a study they conducted of 358 total COVID-19 patients, of which 50 of these patients had moderate to very severe COVID-19 infections. The results showed that all the patients who received the intravenous vitamin C therapy as part of COVID-19 treatment improved. None of them died, and it shortened their hospital stay by 3 to 5 days compared to the non-vitamin C treatment group. So the consensus panel recommends using 50 to 100 milligrams per kilogram of body weight of vitamin C infused continuously over a 24-hour period for hospitalized patients with COVID-19, and higher doses, 200 milligrams per kilogram of body weight, to help control cytokine storm in patients with more severe disease, also infused continuously over a 24-hour period. So for a person who weighs 154 pounds, as an example, that's 70 kilograms. This translates into a total vitamin C daily intravenous dosage of up to about 7,000 milligrams a day, or 7 grams a day. And for patients experiencing cytokine storm, this would be 14,000 milligrams a day, or 14 grams. So some other authorities who have used vitamin C to help combat respiratory tract infections suggest a daily dosage of up to 25,000 milligrams, or 25 grams, of intravenous vitamin C. So as the COVID-19 studies become available here in North America and in other Western developed countries, it'll be interesting to see how many treatment centers are incorporating the Chinese recommendations into their treatment protocols regarding the use of intravenous vitamin C. So how might vitamin C be helpful? Well, many immune cells in the body are dependent on vitamin C for optimal functioning. During an infection, vitamin C is used up much faster, and thus vitamin C depletion occurs more easily. With vitamin C depletion, the immune system becomes weaker, and greater free radical damage occurs in the lungs and also in internal organs. There's also a greater release of what are called NETs, neutrophil extravascular traps, which are known to trigger the cytokine storm. As such, continuous intravenous infusion of vitamin C provides immune cells with a constant and adequate supply of vitamin C, which helps optimize their viral fighting capabilities. It decreases free radical damage to the lung tissue, and it reduces the secretion of cytokine storm-inducing NETs from neutrophils. So this understanding of vitamin C physiology is the reason why doctors in China chose to study vitamin C in the first place. So I've included the references for this information in the text below. Thanks for watching, and I'll see you next time.